welcome to our session. Our topic today is Yes, I can detect cancer early. Yes, I can survive cancer. For this International Women's Day, we bring you some in-depth discussions from the best oncologists, geneticists, genetic counselors, pathologists on women cancers, women health, and its management. Today we have with us Annuradha Rakesh. She's a clinical psychologist and the founder at the Inner Quest Center for Psychological Treatment. Thanks, Annuradha, for joining us.
Thank you, Payal, for making me part of this initiative.
I am so delighted while covering all the other aspects of women health and wellness. We are covering this most integral part that is about mental well-being, and which is definitely a must in today's day and age. So I have a few questions specifically around cancer awareness and psychological aspects during cancer treatment. I'll just lay them out. So how should a woman deal with low self-esteem issues during cancer treatment?
Okay. So before we talk about low self-esteem, we understand what does self-esteem means. It is defined as like the confidence in one's worth and abilities. So what happened with cancer, given the body image issues and like the treatment and hassles associated with all the treatment, everything gets affected. So self-esteem is one of those psychological facets of our being, and that gets completely affected. Low self-esteem lead to depression. It lead to poor socialization, poor coping, and so often it's said that it's better to keep a high self-esteem than the lower one. One should try to upbeat themselves and fight with cancer through high self-esteem. How do we improve it? What can one do about it? So first thing that I feel while we go through the cancer treatment, quite often than otherwise, we just get entangled in the hassles associated with the treatment itself. Neither the physicians nor the family or the patient have enough time to focus on the psychological aspect of cancer at that point in time. So what one needs to do is to understand and acknowledge what they are going through. So once we accept that, okay, this is what is happening to me, while I treat the cancer, I need to understand that it's difficult for me to go through the whole process. Once we acknowledge that, it becomes difficult because unless we accept what is happening to us, we can't deal with it. Okay, many a times patients with cancer, live in denial for a longer period of time. Okay, let's do it. And then they take a lot of time. The first thing is to acknowledge what they've been going through. Second thing they can do is, while so many big things are happening in your life, which has changed your life completely, celebrate the small little things that is happening. Like once you come back home, a smile on a child's face, a friend's call, something that makes you feel happy, a chocolate, simple little things. Set yourself a challenge, something that you feel, because normal routine that you've been following until now has disrupted. You might not be going to work as often that you used to, or you might not be able to do a lot of stuff which you were doing before. So take this time, whatever little time, say, okay, doing something that keep you feel like, okay, I learned this today, or I did this today. So when you're able to do so, you feel much better about yourself. Be more mindful. Mindful means that we are aware of what is happening within me. So there are a lot of negative thoughts, a lot of negative feelings that we build during this period. So when we are mindful about it, then we say that, okay, is it really true? Like right now you're dealing with the biggest challenge of your life, but you have dealt with similar challenges in your life before. So if you're aware that when your mind say, oh, I can't do it, tell yourself, no, I've done that before and I can do it now. So this thing is not that big that my mind tells me that I can't do it. Or sometimes there's an anecdote, people say that, okay, this is my inner critique, telling me that I can't do it, but I know I can do it. My family have told me that I can do it. My professors have told me I can do it. My workplace people have told me that I'm capable. So I need to believe those things rather than believing what my mind is telling me to do. So that boosts our self-esteem much better. Be compassionate to yourself rather than becoming a self-critique. Being compassionate that, okay, I feel pain and it's difficult for me to do it. Okay, what can make me feel cheerful at this moment? So if we develop that compassion which we have for others, we have to build that compassion for our own self and accept that, okay, these are the things that I need to really do it for myself. One more important thing is, when we have cancer, we compare ourselves with other people. Why me? Why me at this stage of time, when I have children to raise, or when I've thought now I'm retired and I'm going to enjoy my life, I'm dealing with this. So there's no life stage which prepare us for something like this. At every life stage, there's a challenge. So we need to learn to accept that. And many a times to compare. We compare ourselves to other people, that look, my friends are enjoying and I'm struggling. Other people on Facebook look so happier, but my life sucks.
The social media life.
Yeah, and or we compare ourselves to our own past. Like, I was so beautiful, I was so pretty, I had long hair, I had this style, I was the one people look up to me, but now I'm not that. So you're not that, you're maybe not going to be that, but the new you could be better than that. So believing that, okay, maybe I can style myself better. I remember Ayushmann Khurrana's wife Tahira, she was talking about when she lost her hair, she was saying that, look, I got a wig, now I can wear a different style every day. So I don't have to be dependent on that one particular style. So sometimes, embracing that change help us grow better. It boosts our self-esteem. It boosts the confidence that we lost because of whatever we're going through. Set realistic expectation. While I say so that, we should think all positive, many a times, all these peer group sessions, people and everybody talks about how we need to be supportive, how we need to be positive, how we need to feel proud of being a survivor. But the reality is, nobody like to call themselves at times that, okay, I am this. Sometimes that feel, okay, I do not want to be. I wanted to be the one I was before. So if we get that kind of a feeling, that's perfectly okay. If we have that bitterness about life at that moment, it's perfectly okay. Only thing is that we do not have to react or do anything out of that bitterness or negativity. We just need to understand, this is at this moment I feel like this. Maybe a bit later, I'll be fine. Tomorrow will be a new day. And a lot of people with cancer, they survive, they deal, they live their life completely. And maybe I would do so. Okay. So setting those realistic expectations help us, again, boosting our low self-esteem. Look after yourself. Do something like, a healthy lifestyle, which we might not have followed because we all take life for granted. We think that everything is fine and it's going to remain so. So now all this setback sometimes pushes back to see life differently. So doing exercise, eating healthy, taking care of ourselves, building socialization. Now, low self-esteem, what happens with that is we stop talking to our friends. We stop talking to people. We stop talking to our colleagues because we think they have a lot of questions they want to ask us and we do not want to indulge. And we avoid socialization. But socialization is a booster against cancer, against fight with our cancers, because support system help us cope better with any illness that we have. So I hope I responded well with your first question.
Absolutely. Thank you so much. And I now move on to my next question. So, while it's a personal choice, what is your take on this? Should women come out and open up about her diagnosis to her social network, professional colleagues during cancer treatment?
Interesting question, Payal, but I think it's a personal choice that should we share this information with the world on social media or professional colleague. But what we have seen that if we communicate this to our workspace, you can start with like confiding with someone that you feel comfortable with, and you feel that the person is able to understand you, because you might need to take some leaves from the work and all of that. So creating that support network at workspace helps coping with cancer at that point in time. Regarding social media and Twitter and all of that, like there are several studies recently about this. But if the person feels confident in handling that, it creates a support network in terms of peer support. A lot of people connect and tell you positive things to cope and everything. So if you feel that you are ready or you have that time and space for that, you can do that. I would like to add here, like with regard to family and friends, at times people struggle a lot. So when they break this news to the family, there's like bombardment of a lot of people coming to you, responding to you. And many a times it becomes very irritating because you have to repeat the same thing to different people. And if you feel that you are not in that position, take a stance, make someone available on behalf of you, suppose you are married, your husband. If you're single, someone in the family, a friend who can respond on your behalf and say whatever you've been going through if you can't deal with it. And if they try to reach out to you, if you're not available, consider that you're blessed that there's so many people who's trying to be with you. If you can't respond at that point in time, suppose you have a bad day, respond at a later point in time whenever you think that you can take out time. But rather than taking all of those things negatively, I would say that considering that how we need to use those resources helps. Like often people say, tell me, what can I do for you? Is there something but if you feel one day there's nobody at home to go with you to the hospital, ask a friend of yours who is planning to offer you something. Say, come along. If you feel that you're getting hassled at home, you need a company, call someone. If you need I am not able to cook, tell a friend to bring something interesting to you. We can use those things and be happy about it, rather than completely shutting the door and saying that, okay, this phase of my life, I have to deal with myself. There's small little things help us connected with the world, help us cope and resolve to the better version of dealing or coping with the cancer.
Yes, both the answers, frankly, Anuradha, resonates even for a person with or without cancer treatment undergoing a challenge or another issue or low self-esteem because of some other event. But I think your tidbits were very easy to digest and very clear of what can one do to feel better and to have a higher self-esteem and cope up with the treatment with a much positive state of mind. I have just one last question. Is there any other message for us women on this International Women's Day that you'd like to share?
I would just like to say that women have enough and more challenges in their life. But there are multiple wings that they can't even see. So only thing that we need to tell ourselves that I'm bigger than my problem. And this phase of my life is bigger than the life. It can never be bigger than the life. So I just need to cope and deal with it with a smile, the way I have done all my challenges in my life.
Thank
Is there anything else, Payal?
No, thank you so much. Thank you for sharing your pearls of wisdom with us, and thank you for joining us on this session.
Thank you, Payal. It was nice talking to you.